So there's six. There's six markers that should be the standard marker anytime you're looking at thyroid function. Unfortunately, many doctors will only look at one, and they look at TSH, and TSH stands for thyroid stimulating hormone. Now, TSH is not made by your thyroid, and it's not a marker of thyroid function. TSH is a messenger hormone produced in your pituitary that tells the thyroid, this is how much hormone I need.
Correct.
So TSH, if it's high, it's telling the thyroid, I need more hormone, I need more hormone, I need more hormone. Well, that's important, but that's a measure of pituitary function and not thyroid function, because there's something called euthyroid, euthyroid, where your hormone levels are normal, but TSH is elevated. Well, wait a minute, there's enough hormone in the blood test, but the pituitary is telling your thyroid you need more hormone. That's an example where TSH is not a marker of thyroid function. It's a marker of your body telling your pituitary, and the pituitary responding, saying, we need more hormone. But wait a minute, there's enough hormone in the bloodstream for some people. What does that mean? It means it's in the bloodstream. Your bloodstream's just a highway. It's just a highway carrying a lot of traffic. It's all going in the same direction, but it's a highway. But if the hormone can't get inside the cell, then the cell is functioning as if there's not enough hormone. And that functional disruption is what triggers the pituitary to say, we need more hormone, we need more hormone. So when you understand that concept, then the question is, well, why would anyone ever use TSH as the only marker if there's a problem with the thyroid or not? And the answer is, well, we've always done it that way, and that's what the textbooks say, and that's what insurance will pay for easily, so that's how we do it. That doesn't cut it anymore. And if you have a doctor that responds that way when you ask them the question, in that case, that doctor may have some really good skills, but you need another doctor on your team who has a little more current outlook on that. So, Dr. Shel, could you repeat those different tests that you mentioned once again?
Absolutely. So TSH, like you mentioned, the thyroid stimulating hormone, free T3, free T4, reverse T3, which is extremely important, anti-thyroglobulin antibodies, thyroid peroxidase antibodies. And some people like to get a total T4 as well. So those would be the crucial ones that you want to get, because that will tell you so much about what might be going on. As an example, if you've never had your reverse T3 checked, and if your reverse T3 is on the high end of normal or even higher than the normal range, you're going to know that something is awry, because your T4 should be converting to T3, which is the active form of thyroid, not reverse T3, which actually will bind that receptor site that actually is waiting to be bound by the T3, the good stuff. So it's going to bind it and not allow for that receptor site to be open for the T3. And a lot of times that could be an effect of excessive stress, adrenal issues, nutritional issues, toxicity, perhaps even estrogen dominance.